So what we're talking today about is boots and cam walkers. So a cam walker is a walking boot. A couple things to know about cam walkers are, hang on to that for me. This is the pneumatic type, which just means there's an air bladder throughout the soft portion. When we're utilizing that, this is the pump portion and this is the release valve. It's to help with swelling. It really just gives a more uniform, supportive fit, but not everybody needs those. There's some, and I don't have one with me, that doesn't have the pump, and the provider will let you know if we want the pump or not. So there's the small one, and then there is a tall. So the short and the tall, and we'll kind of direct you guys in what we need. So we're going to show you how to fit a cam walker. So Candy said she wore an 8.5. So an 8.5, I would guess, well, maybe that's going to be a small, and maybe that's going to be a medium as far as the size. We're going to just try her with the short ones. So I think probably a small. We'll try that, but bring both in, a small and a medium. Some other points of consideration when we're doing a taller one is how large the calf is. So Candy would be fine, but you know, some folks have a larger calf, and then we might have to upsize so we don't pinch the calf too much. So that's a point of consideration. What we'll do is bring the person down in the chair, and I'd like for the person just to sit, and then we can fit from the side like this. That way the heel can go all the way down when we're fitting it to them. A couple things to Christine is doing here is kind of putting that the Velcro pieces together so they don't get in the way when you're trying to fit. And then patient will seat their foot in the boot.
All the way up against the back.
So we're having all the way back. And then you can kind of get an idea, yeah, that's going to be the right one. If toes are hanging over really close, then you might just go to the medium at that point. But this would be good. Now, Christine is strategically using these little pads. The one in the front of the ankle there is really important because that strap runs right across that area. And if you don't use a pad there, it irritates the front part of the ankle.
The strap cuts across.
It does. And so we'll get that on like that. And then what you'll do is go ahead and kind of put a couple little pumps in the boot for the patient, and you teach the patient along the way, hey, this is a little air pump. We're going to pump it up until it feels a little bit more compressive around there. Does it feel okay? And this is how you release it. And you can actually even show them how to release it so they have get the idea in the office. And then you might pump it up just a few more and just ask, does this feel okay? Yeah, that feels fine. And then we're going to teach them how to walk with it. So we always say, go ahead and put your other shoe on if you would. And when we're walking, it's a rocker bottom.
So you heel the toe.
You heel the toe with that. Yep, exactly. And you'll notice a couple things. One is it's a little bit of a chunkier heel than our other shoe. So we're going to recommend to the patient to go ahead and try to wear a tennis shoe on the other side that has an elevated heel. If it's a really significant difference, will you grab one of those Even Up for me? What we can do is ask the patient if they'd like to purchase a product called an Even Up. And this Even Up, you can see, just goes on the external part of the opposite shoe, and it just takes some pressure off. So if somebody has low back, hip pain, it's an out-of-pocket expense. So patients will have to choose if they're going to buy that or not.